Today's drug of the day, Adenosine, the 10-second wonder drug for SVT. What's up, you guys? It's your ER pharmacist, Lil Pharma. Today we're talking about Adenosine, the medication we use most commonly to get people out of SVT. How it works, it's going to hit those A1 receptors in that AV node and stop calcium influx into that AV node, stop conduction through the heart. So decreasing that reentrant rhythm, actively stopping the heart for a few seconds. The reason it only stops for a few seconds is because this medication has such a short half-life. So the half-life is like 10 seconds, not even. Patient's heart kind of stops for a second, but then it flips it out of that reentrant rhythm, which is the goal. Downsides of adenosine. People are going to feel horrible. Again, only for a few seconds because that short half-life, but they're going to feel this sense of impending doom, kind of chest tightness, flushing. Not a great sensation, but if it flips it out of this rhythm and it's only a few seconds, most people would say this is worth it. Initial dosing is 6 milligrams. If this doesn't work, we'll give 12 milligrams. You're going to push this as fast as you possibly can. So you're going to slam it. Best way to do this is with one of those 3-way stopcocks. You're going to push it, the adenosine, slam the flush, and get it in as quickly as possible. You can also dilute it in 20 mils of saline and just push that as quickly as possible. Both methods have been shown to be effective. Okay, contraindications. This is contraindicated in patients with AFib with WPW, so Wolff Parkinson White, because it can cause arrhythmia. This is also going to be contraindicated in patients with asthma because it can cause bronchospasm, and then people with a full AV block, this can also be problematic. So making sure you have your pads on, especially if you don't know the patient's history super well, you might want to put those pads on just in case you have to shock them out of a fatal rhythm. So that doesn't happen very often, but can happen. That's what I got for you. Next time, we're going to talk about other agents that you can use to get people out of SVT. Follow me for more clinical pearls so that you can be better at your job.